Joining us now from Henry Ford West Bloomfield Hospital's stroke program is Dr. Hebah Hefzy. She is the medical director of the program over there that just recently earned a recertification as a thrombectomy-capable stroke center, and she joins us now on the Megacast. Doctor, thank you for being with us today.
Thanks for having me.
Appreciate having you on. So stroke, it is the fifth leading cause of death in the United States at this present moment. And, of course, as I said, Henry Ford West Bloomfield Hospital just recently re-earned its certification as a thrombectomy-capable stroke center. We'll talk more about what that means and the implications of that recertification. But let's just start with the basics about stroke. When somebody suffers from a stroke, minor and severe or anywhere in between, physiologically, what is happening to their body and what impacts can that potentially have on them should they survive?
So strokes are caused by blocked blood vessels and blocked blood flow to the brain. And as we say, time is brain. So it's very, very important that the moment that stroke symptoms are identified, that emergency medical attention is sought immediately, because there's so much we can do now to reverse a stroke, but it has to be done quickly.
And so some people have strokes that are relatively minor and they get the treatment, and afterwards there's a little bit of recovery time, but generally they're fine. And there's others that have severe strokes that either result unfortunately in death or in severe symptoms even after the fact and significant rehabilitation to live even a fraction of what they considered normal life before then. Are there different kinds of strokes, and what determines in one individual versus another how severe or what kind of a stroke they may have?
That's a great question. Yes, there are different types of strokes. So in a broader sense, there are strokes that are caused by bleeding in the brain and strokes that are caused by lack of oxygen to the brain. We're going to focus on the strokes caused by lack of oxygen to the brain. There are many different causes of those types of strokes. You can have a blocked blood vessel, a large one in the neck. You can have a blocked blood vessel inside the head, and you can have very small blood vessels that are blocked that we can't even see. And the only way to know which is the cause is by CT scan, which can only be done in the emergency room. Once we do that CT scan, we can see, is there a blood clot in the neck? Is there a blood clot in the head? Or is there no blood clot? And depending on what we find, we can target treatment for that. The focus of this talk is on blood clots, whether they're in blood vessels in the neck or in the head. And that's where the certification that we have been recertified for is looking at. It's thrombectomy, which is removal of those clots.
So you mentioned earlier, you said time is brain. For those that may be suffering a stroke or people that may witness somebody that is suffering a stroke and is helping them to seek as immediate of treatment as possible, just how does time factor into the results that someone may be dealing with in the wake of having a stroke?
Sure. So the treatments that we have to offer for acute stroke they can only be given within 24 hours of the time that the patient was last known to be normal. There are IV clot busting medicines that we can give, but those can only be given within the first 3 to 4 hours from the time that patient was last known to be normal. Some of the treatments where we remove the clots can be done up to 24 hours later, depending on how much brain tissue is still salvageable. And that's something that we're able to quantify by CT scan.
We're joined by Dr. Hebah Hefzy. She is the medical director of the stroke program at Henry Ford West Bloomfield Hospital, joining us today on the Megacast. And so stroke, as we mentioned earlier, the fifth leading cause of death in the United States, being that last year in particular at the height of the early stages of the pandemic. And even now, as people may continue to unfortunately be more reluctant to go to a hospital to seek treatment for emergencies or even for those routine checks that could potentially prevent eventually down the line situations such as having a stroke. Have we seen a greater number of strokes here in Michigan or here in the local area, or even just in general across the board, as a result of the COVID-19 pandemic, both from the effects that COVID has on the body and on top of that, the ways that people have been interacting with our health systems while trying to stay safe with the pandemic?
Yeah, those are great questions. So yes, we have definitely seen a rise in our volume of patients coming in with stroke symptoms that are found to have blood clots in the larger blood vessels in their brain. Not often, but sometimes in those patients, we do find that they do have COVID, and no other reason for that blood clot is found except for COVID. And we know that COVID does increase your likelihood of forming blood clots. And so we have seen COVID-related strokes, and in patients who have COVID-related strokes, the cause is almost always a large blood clot in one of the blood vessels in the brain. And those patients, when they present to the hospital in enough time to have the procedure done where the clot is removed, can have just as good outcomes as their non-COVID counterparts.
So for those that are not immediately familiar or don't have that expert recognition of the signs and symptoms of stroke, what are some of the keys that people should be watching out for if they notice some behavior physiologically or just behaviorally?
Symptoms of stroke can range anything from loss of vision, facial droop, speech difficulty or inability to speak, a sudden severe headache, numbness, tingling, or weakness down one side of the body, or even just in one limb, an arm or a leg, difficulty walking, sudden severe dizziness. The key is that the symptoms typically come on suddenly, and that there's not always a warning sign for stroke. When a stroke happens, it happens right away. And right away when those stroke symptoms appear, 911 should be called.
So we've heard of silent heart attacks, but is there such thing as a silent stroke where those symptoms may be so benign that someone may not even notice them?
Silent strokes happen. Those are not typically caused by large blocked blood vessels. Those are typically caused by blockage of very small blood vessels. When a large blood vessel is blocked, the symptoms are usually identifiable.
And so, as we mentioned earlier, Henry Ford West Bloomfield Hospital just recently received its recertification as a thrombectomy-capable stroke center. For those that are not familiar or wondering what that is and why this is so significant, what goes into being a thrombectomy-capable stroke center, and how is that beneficial on an emergency medicine front here in our local area?
So this certification, so that in order to be a qualified center to treat acute stroke to the maximum degree, you have to go through a very stringent qualification process. And then once you get it, you are commonly audited and have to adhere to a very strict code to keep that accreditation. It's a national site, the Joint Commission, that surveys the organization, and you can be anything from just a primary stroke center that does not do thrombectomies, which are the majority of stroke centers actually. And then there's the thrombectomy capable, and then the higher degree from that is the comprehensive stroke center, which our main campus in downtown Detroit has. At Henry Ford West Bloomfield, the thrombectomy capable site allows us to be able to do all of these procedures where clots are removed and acute strokes are treated here in our hospital, and the patients are then admitted to our ICU and our stroke unit and taken care of by stroke certified neurologists like myself.
So then, procedurally speaking, in layman's terms, what is a mechanical thrombectomy, and how does that provide an immediate benefit to stroke victims?
So a mechanical thrombectomy is a procedure that's done where a catheter is put in a blood vessel in the groin typically, and then iodine or contrast is shot into the blood vessel so we can get a picture of the inside of the blood vessel. And when we see the blood clot, we're able to suck it out just like with a vacuum cleaner.
So is this a procedure that's typically done in an emergency setting, or is this a scheduled procedure?
It's done in an emergency setting. The patient is identified in the emergency room. The team is called in from home. It's a whole team that involves an anesthesiologist, a surgeon who does the procedure. It's coordinated by the stroke neurologist who's on call and the emergency room doctor. So there's a big team of people, and we're all working together simultaneously. And all of these things happen within minutes. And the team comes in, and the patient within an hour maximum of arriving to the emergency room would be on the table having the clot removed from their brain. And that includes the time it takes to have the tests to identify where the blocked blood vessel is and the time it takes for the team to come in. But once the team is here, the procedure is actually very fast and it's very efficient, and results are seen typically almost right away.
We're joined by Dr. Hebah Hefzy. She is the medical director of the stroke program at Henry Ford West Bloomfield Hospital, with us today on the Megacast. These are all great. This is all great for treating stroke in an emergency setting and preventing those immediate dangers from resulting in severe symptoms in some cases, or at the very least, keeping the patient that may be suffering from a stroke alive. But I think I would, and correct me if I'm wrong in speaking for the medical community, they'd rather have these patients never come in and have to deal with a stroke altogether. So what, for those that may be at risk of stroke, or even just the general population, what lifestyle changes are suggested by medical experts such as yourself and your colleagues to prevent stroke?
That's a great question. It all starts with prevention. So common risk factors for stroke are high blood pressure, high cholesterol, diabetes. These conditions need to be treated by the patient's medical doctor, and you should, if you don't have them, you should be screened consistently for them. Diet is very important, a heart-healthy diet, a low-fat diet. Exercise is recommended by the American Heart Association, 30 minutes of pretty moderate, vigorous aerobic exercise 5 to 6 days a week. And there are certain conditions of the heart that can increase your risk of having a stroke. Irregular heart rhythms can cause clots to form in the heart and go to the brain and cause stroke. And you should be seen by your doctor to screen for those irregular heart rhythms. The most common one is atrial fibrillation. And if that irregular rhythm is identified, then you need to be on a blood thinner to prevent clots from forming and going to the brain.
Doctor, just a few more minutes with you before we'll say goodbye today. Anything else at this time that would be important for our audience to be considering to prevent stroke, to recognize stroke, or that they should understand about the treatment of stroke if themselves or someone else in their life should suffer from one?
I think the most important thing that I want to get across is time is brain. And often when somebody starts exhibiting stroke symptoms, 25% of the time they can crump very quickly. And so it's really important that you not wait and you not try to drive yourself to the hospital. If you or somebody you know experiences any symptoms that suggest a stroke, no matter how minor they are, you should call 911, because the emergency triage team will know which hospital to take you to, because not every hospital is certified to treat stroke patients in this aggressive way. And so you want to make sure you call 911 so that you're taken to the closest hospital that is equipped to treat stroke.
Well, Doctor, we appreciate your time. Thank you very much for being with us today.
Thank you so much for having me.